This is the Mind Body Detox Podcast, where we discuss all things integrative health and wellness, interviewing folks from all over the world, sharing insights and wisdom on how to live a healthier life in mind, body, and spirit.
So, going into recovery for someone who's struggling with mental health issues, what is full recovery? What does that look like? And when someone has nutritional deficiencies or they are addressed in a functional medicine way, what percentage of patients will have full recovery?
So as I talked about in the textbook that I wrote, in my practice, I was getting about 95% recovery, which was defined, or 95% response rate in patients, defined as people feeling 85% better or more better.
And that's with compliance to all the treatments and the things that you're having them do, correct?
Going through the program. Yeah. Going through the process and the program and putting their own work into it. This is not a passive type of situation where you can just be the recipient. And in fact, I've told many patients over the years, I said, if you've come here just so I can prescribe something to you, I'm not your guy. I'm not your doc. There are lots of people who can do that. I wish you well, but you need to go find somebody else, because that's not how I work. Because I don't believe that that's in their best interest ultimately. And they're not ready for this approach, and not everybody is, and that's okay.
Yes.
I also believe in, meeting people where they're at, meaning if you think it's so overwhelming because you're being asked to improve your diet, and you're not exercising, and you're being asked to exercise. Oh, wait, and your sleep isn't well, and so you've got to start working on your sleep. Oh, and your interpersonal relationships are not doing well, so you got to start working on that. It can be so overwhelming so quickly. Just start somewhere. You don't have to do everything at once. Just take baby steps. It's the consistent small changes done over time that are going to give you huge, huge results.
Absolutely.
So that's the most important, I think, thing.
Yeah. I mean, it takes years, 10 years for me to be, I would say, more fully recovered from my anxiety and depression and struggling with that. And I think that some people want it to happen overnight. They're expecting the old method, or the way that would be giving a pill and then the symptoms, subside, or they're alleviated for a temporary period of time. But what I think is important is, we're going to say something?
Yeah, and what I know about myself, because I'm a human too. I'm a person too. I've gone through periods of my life of depression. I lost my mom years ago, and that was just horrific to watch her health decline over time. And when she died, we all go through our struggles, and we all have had some trauma in our childhood. Nobody gets out of childhood. There is no Leave It to Beaver family. That idealized world, I think, does a great disservice to people, because there is no what's a quote unquote normal family. That doesn't exist. Every family's got their stuff. So what I've learned is that the people who don't succeed are the ones who stop trying. And that once you find the right process, the results will begin to take care of themselves. And so continue to just focus on the process. When you find the right process, the results will begin to just take care of themselves.
Yes. And I want to remind the listeners too, some of you out there are new to journeying down your wellness path and learning more about how you can take care of yourself. And some of you are holistic health nuts. You love all this stuff. And I think remembering what Dr. Neustadt said about not everybody's approach would be holistic or functional. Some people need to maybe take a pill, or they need to go down that road. Because I think a lot of people in the holistic health arena, they get so jazzed up about how this stuff really does work, but you have to put the work in, that they then sometimes try to push it on all their friends and family, and people aren't ready for it. And then they get overwhelmed when someone's trying to force diet change or whatever. It becomes naggy, and then actually turns people off to it because they're just not ready yet, or it's not appropriate for where they're at.
Right.
Yeah.
So true.
Yeah.
Have compassion. I think we all just need to have more compassion for each other.
Absolutely. And that does go along with meeting people where they're at. You have to have that empathetic, space where you can understand where they're coming from. So I want to know more about what role detoxification, excuse me. I want to know more about what role detoxification plays in healing depression and mood, because with my story here I shared at the beginning, lead exposure is pretty severe. And that's something that is one particular extreme example of a toxicity issue, but there's all these environmental factors that can play a role as well. But how do you approach detoxification with functional medicine and healing depression and anxiety?
So if somebody's tested for toxic metals, there are protocols that can be followed, both oral protocols and intravenous protocols. We're actually infusing a substance in the body like EDTA or DMPS. Typically, I use EDTA that would grab onto metals. They're called chelating agents and pull them out of the body. I don't recommend people do this on their own because you've got to make sure your kidney function is proper. It's gonna flush those through the kidney. So you've got to tailor the dosage to the kidney function to make sure that it's safe. And I like to give supportive antioxidant nutrients to help protect from any damage that may be caused or potential damage that could be caused by mobilizing those toxic metals and moving them through the body. There are ways to do it safely. Now, toxic metals are not the only issue, and lead of toxic metals is not the only issue. There could be cadmium, it could be arsenic. There are different mercury, different metals that can be tested for.
How often do you find that
And
in your patients, that exposure to some of these toxins?
so I typically here's the challenge with that. You don't know how often it's there unless you test it often. And for me, it's not typically the first thing that I test. I think more common than that are these nutritional deficiencies. Now, as part of an intake, there should be an environmental exposure, toxic exposure portion of a good intake. And that includes knowing where somebody's living, is there toxic metals in the water or a history of it, perhaps in the soil. Where my practice was in Montana, there's a lot of mining in the state. So depending on where they were in the state, it would just be higher on my radar and to potentially test than people living elsewhere, for example. There are there are other toxins that aren't metals, soluble or solvents, for example, that could be creating issues. So that could be something depending on somebody's profession if they're being exposed to these toxins. And the route of elimination would not be through a chelating agent for some of those organic volatile compounds. It would be a different detoxification protocol. So it's not you ask a great question, and I don't know that I can give you a great answer other than to say that I personally did not see it that often as being the driver for depression.
Yeah. Now I will just say in this South Central Pennsylvania area, and actually Pennsylvania, we have one of the highest rates of lead toxicity because of the age, and they were even comparing it to Flint, Michigan too, that we have, and that's like the big story
Wow.
they talk about, oh, Flint, Michigan, because of the water issues, but that's something that there's so much more exposure, especially with young children, to old lead paint and stuff like that they always ask, do you live in an old house? Yeah. Well, do you have lead
Right.
paint in the house? A lot of times you don't know. You're like, no, we don't. We think we're good. But I think that that's something that just is in this particular area. But I can see why it makes sense that nutritional deficiencies would be more prevalent. Our last episode we just did was on regenerative agriculture and how the microbes and all that connects to your gut health and the deficiencies in minerals in the soil and the food. So it makes sense from a functional approach to address those things first, as they probably are the most prevalent. But I appreciate your answer for that, because I was just curious about how detoxification plays a role and, how often you're seeing it.
Well, if you're following my dietary recommendations and what the research has shown over 70, 80 years to be the healthiest dietary pattern, you're naturally going to be improving your detoxification. So fiber is a great substance for binding toxins in the bowel and eliminating them in the stool, as well as eating a plant-forward, whole foods, Mediterranean dietary pattern or style diet is going to be giving you adequate micronutrients, those vitamins, minerals, plant antioxidants that are going to feed those liver detoxification pathways and help them to perform better. And my recommendation for people is they eat at least 30 grams of dietary fiber per day, not as a supplement, but from foods, whole foods. And there's actually another blog on my website called Dr. Neustadt's 3 Steps to Eating Healthy for Life. And in there's a link to a PDF where you can see the fiber sources of different foods. And I just have people focus on 2 things. I try and keep it simple, right? Just focus on protein and fiber, getting enough protein and fiber. And transitioning into eating that way over whatever period of time is comfortable. Most people aren't already eating that way. So whether it's 4 or 6 weeks, because it often requires different way of shopping, using different spices, cooking differently, having different snacks in the house, those sorts of things. So this is not about a diet, a crash diet or a short-term diet. This is helping people learn and understand how they can eat and live to promote their health for the rest of their life.
Yep. Yeah, and I think that time and that role that you play to be meeting where they're at, meeting your patients where they're at, I think is really a nice, compassionate way, because I think a lot of us in our culture have a hard time with change. Well, anybody has a hard time with change, but changing your diet and your lifestyle, sometimes that's people, they hold on to their old patterns because it's comfortable.
Well, and they're existing patterns too, because what we know is people are essentially a sum of those with whom they're surrounded by whom with whom they associate and are surrounded by. So behaviors are affect each other. People's interactions in the household affect each other. What the research has shown is that if somebody is eating unhealthy, that their first relationship, those that are close to them are most likely to be eating that way as well. So if you're living in a household with somebody else, those behaviors and people's behaviors are contagious. And so if you are actually trying to change what you're doing, it's important also to have that conversation with your partner to say, this is really important. I want you on board with this. This is what I would love to do it together with you. And having that power partner is fantastic. And if they're unwilling to do that, then you just need to resolve that you're going to take the steps to do it yourself. And what often happens as one person begins to shift and make those changes, the other person starts to come on board as well.
Absolutely, because they see the results and they see you're feeling better. And yeah, I've seen that so often with our clients at our clinic and with their family members and their spouses. They just eventually they joke with us to say we drank the Kool-Aid to be healthier. But it's a good Kool-Aid,
Kool-Aid.
It's the good Kool-Aid. Yeah.
Yeah.
So tell us a little bit of why do we have some doctors that are resistant to integrative and functional medicine? I'm curious about that because I've experienced, talking with some of my healthcare providers and saying I'm working with a functional medicine doctor. And I think that there might be just a matter of just lack of education, or maybe they're intimidated or they don't know. But I've got some really interesting reactions. And I want to know how we can understand this better and maybe how we can best advocate for ourselves when we are working with a primary care physician. And then we're also working with a functional medicine practitioner of some sort.
Yeah. So I think a lot of it boils down to ignorance and hubris. I've had lots of conversations with conventional colleagues. One told me, if it's not taught in my medical school, it's not medicine. So there's that attitude that's still out there. Another is that, well, if it worked, it would be covered by insurance, which is an assumption and not accurate. There are lots of reasons why uh, completely effective and safe approaches are not covered by insurance, despite clinical trials and years of clinical documentation. And the other thing is just a closed-mindedness to it. I had another friend of mine. She's an ER physician, and we were out for a walk actually not that long ago. She's gotten interested in integrative medicine. She started taking some classes in it, and she was telling me a story of a patient who came in with a specific heart condition. They were going to die, and she had remembered that an infusion of magnesium might help, and gave an infusion of magnesium, and it saved their life. And that's something that's pretty commonly known in emergency medicine. And I asked, let me ask you something. Why, that's your experience, and you know that magnesium works, and that's commonly known. Why is it that your colleagues don't make the jump in logic and think, wow, if this one nutrient worked for this one thing, maybe there are other nutrients and many other things that might be helpful too? And she never thought about that. She said, I don't know. I think one of the reasons too is everybody's busy. We have, people have families and they have student loans they've got to pay off, and they're working their butts off, at the clinic, and they're exhausted at the end of the day. It becomes really challenging to juggle all of that and then say, I'm going to carve time out to learn an entire new field of medicine.
Absolutely.
When they're being successful in their field, they're advancing, their incomes are going up, there's no pressure for them to do anything different.
Yeah.
Insurance companies are reimbursing them. And so there's really not a lot of pressure, except for the ground up and the bottom up popular pressure, where patients are now more and more asking for that information, wanting that information, and demanding clinicians work with them who are knowledgeable in these areas.
So how exciting is it for you to be in the kind of innovative part of your field? Because every field has some people that are kind of pioneering and doing new forms of that particular line of work. And how does it feel for you at this time, to be educating and really supporting other doctors as well to learn this? Because it's only a matter of time, right? I mean, to me, I believe it's only a matter of time before we have medicine that is more integrative in this way. 20 years, 30 years from now, I don't know how long.
It's moving in that direction. Definitely, I've been, a clinician and, for 15 years, and researching and learning for, over 20. And it's definitely moving more in that direction. It feels incredible. It feels amazing because it is good medicine. It is good healthcare. It is a logical, rational approach that not only people intuitively understand, but that they want. Here's a great story. So my practice was in Montana. I live in San Diego now, but my clinical practice where I started used to be in Montana. There are a lot of ranchers in Montana. I got a lot of these folks coming into my clinic. They wanted a nutritional medicine approach. They wanted an integrative, functional approach because they know with their cattle for years, if something's wrong with some of their livestock or their horses, they just don't go shoot them. They've got to figure out what's going on. And they know that oftentimes it could come down to the nutrition of the animal and what's lacking. A mineral might be lacking in the feed, or some nutrient might be lacking. And so they were really open to this approach. And I think more and more people are catching on that, hey, this endless prescription of medications, of just treating symptoms, I'm feeling better, but I'm not getting better. And so I think that they're looking for more and more in this approach. And the internet does a great job, as well as, I think, a disservice to people. The great job is that it really can help popularize this approach and educate when people get the right information. But it can also, unfortunately, there are unscrupulous people in every industry and on the internet as well, it can steer people in the wrong direction as well, which is why I'm a big proponent of people finding an integrative practitioner, finding somebody to add to their healthcare team, not do away with your conventional practitioner, but assemble a team that you can trust and rely on to give you the information and help you make better decisions and guide you through these processes.
Yeah. If you feel it's not a good fit, it's really your choice to choose a different practitioner. I think some people really don't feel comfortable or safe. They feel that they have to listen to whoever they're assigned or who they choose. It depends on if their insurance has given them a couple people to choose from, and then they have to select from a pool of people. And I always go look at pictures and look at background, and I go and I meet with the person if I'm able to. And if they're just not a good fit, I really think that you should feel really a good connection with your practitioner. That's just all around what I believe, for sure.
So here's a true story. So in 2000, I was working in the high-tech field in Seattle. I was working as a project manager at different software companies, and I was miserable. I didn't like that profession. It wasn't great for my personality. I started to get sick. I hadn't been sick before. I needed a doctor, so I just looked, which doctor will my insurance cover? And I went to that medical doctor. I had no idea who it was. They walked in the room. This person walked in the room. He already had his prescription pad in his hand, and he talked to me for less than 5 minutes, was ready to wrote me a prescription, and I was wanting to ask him questions. I was trying to understand. I wanted to understand what was going on with me and see if I could fix it and understand what's happening. He visibly became annoyed at my questions and wanted to get on, I believe, to the next patient. These are short visits. I was not happy. Medicine is a service industry. Just like going to a restaurant. If I don't like the service of that restaurant, I don't go back. Yeah, maybe I give them another try. Maybe they're having an off day, but I may not go back. I was not happy with the service that I got. And I'd heard about Bastyr University, it's naturopathic medical school in Seattle. Their teaching clinic was just down the street. So I thought, well, I've got nothing to lose. Let me see what these people have to say. And I went and made an appointment, and it changed the trajectory of my life. I went in, I was great. I was fortunate enough to have the chief medical officer at the time. He was the attending attending physician, and 2 student clinicians. They spent 45 minutes with me more, asked me lots of questions, really got to understand me. Same initial diagnosis as the medical doctor, but at the very end of the encounter, the clinician, the head clinician, Dr. Jamie Wallace, he looked at me and he said, "You need to quit your job." That was the underlying cause. It was stress-induced chronic stress causing these issues. Yes, they answered my questions about my body. They gave me some other things that I could do as well. But he said, if you're looking at the underlying cause, much of it for me was situational at the time. And it was depression. It was as well as physical manifestations of that starting to happen. And I had already been thinking about going back to medical school. I was already passionate about integrative medicine. And I think I was just looking at that point in my life for third-party validation, for somebody to just validate what I think I already knew to be true. The next week, I quit my job and I started enrolling in Bastyr to follow a career in naturopathic medicine. But that's the power of creating a relationship with a doctor instead of a 5-minute appointment.
Yeah, absolutely. And I think there's just more of a healing, when you have a healing relationship with someone in general, whether it's a counselor or a doctor, there's that psychological component there that I think is just, you have that trust factor that helps relieve a little bit of that anxiety. Look, if I can't figure it out, we're going to figure this out together. And I think that really relieves some of that anxiety that, people are maybe looking at as well with, since we're looking at anxiety and depression today too. All right, Dr. Neustadt, what are some actions or practices that our listeners can do today to start their journey? What would you recommend for someone who wants to really learn more or take a step into more of a functional health approach for their life?
That's a great question. the first thing somebody can do is set their intention. Just decide that you're going to figure out how to get the resources and the information you need to go through down this pathway. You can go to my website, nbihealth.com. There are tons of free resources on there on all sorts of different health conditions, practical tips of what people can do, questions they can ask their doctor, and products where you can actually start promoting and improving your health. These are the products that I created for my patients because I couldn't find what I needed to help them. The second thing people can do is you can Google functional medicine in your area for a functional medicine doc, and just start to make some inquiries. Start to ask around what they do, and some of the things to ask them, because there isn't a official sort of national board certification in functional medicine like there are for cardiologists. You can ask them, where how long have they been doing it? What type of continuing education are they doing in functional medicine? And you may hear that they're taking classes from certain labs. You may hear that they're taking classes from the Institute for Functional Medicine. These are all good things. I think also to recognize and understand that this is not something that everybody is equally trained into the same level, like all doctors. So if you go to somebody and they say, I'm a functional medicine doc, and maybe you don't get the results that you're looking for, don't discount the entire approach, because people have different levels of capabilities and understanding and knowledge in this area. But what is valuable is if they run labs, to make sure you keep copies, you get copies of all of your labs, because if you decide, maybe you've plateaued, this one practitioner has taken you so far, but you're not getting more improvements, you've plateaued and you want more, well, you could take what you've already done, and you can find somebody else and not have to repeat all those labs again and go through that expense, and they can maybe build or have somebody else evaluate it. One of the things that I do is I will oftentimes, if people reach out to me, I will frequently just say, hey, send me your labs. Let me take a look at them. I'm happy to chat with you about it and just let you know, hey, is there something that might be missing that you can go back and ask your doctor, even if they're not patients of mine. So making sure that you decide that you are just not going to give up until you get the results, and you are the paying customer. Right? This is a service industry. If you're not getting the service that you want, then you need to make a change, and you're in the driver's seat, and you are the smartest person in the room when it comes to your body and your mind and your emotions, not the person sitting across from you. That doesn't mean to discount or approach them with cynicism, but what it means is, if you follow their advice and their recommendations, if it's the right process, the results will take care of themselves. If you're not getting the interaction that you cherish, look, I'm not everybody's cup of tea. It could be a personality match. It's just not right. Whatever it is, go on to the next person. Next. Okay, that's not working. Next, till you latch on to what you need to take you all the way to feeling as fantastic as you want to feel and you're able to feel.
I think that approach is really beneficial for all categories of work too, because I think we don't always have that permission to up level. Even if you're like, I'll give an example. In our clinic, we have massage therapists, and then we have medical based massage therapy. So we have that more relaxation sense of massage, and some people, they need more of that therapeutic work, and they think that one massage is going to get rid of their back pain, and they may need more of a different practitioner. Or if you're working with a coach, like if you're doing sports or you're an athlete, as you up level your coach. as you do the work,
It's
you
true.
get you kind of, okay, I need someone at a higher level now. And it's not that they're not good enough or they're not, just not a good fit anymore. I think that that mindset, looking at all aspects of our life to be able to allow ourselves to have growth in who are our helpers, who's our team, in their spiritual sense, a body sense, all that stuff, I think is really important to keep in mind. And I love what you said about, it is a service industry. The healthcare is a service industry. And I think that as we as consumers make different choices, have different needs, the demand will rise for functional medicine and for wanting to take responsibility for our health. And I think that's what's the most beautiful thing about this time is there's a collective a shift in almost the consciousness is how we view our power and how I can take control of my life in this way. We're seeing in people wanting to change their jobs and having all that time over COVID to sit and think about these things and to set that intention. Like you said, that's the most powerful thing, to ask a different question, setting an intention, and now it drives your whole life into a different direction. And I think if we do that, each of us individually, eventually that changes the market and it changes the demand, and we have then more doctors and medical professionals and in all aspects of life, of things, approaching things from a more holistic perspective and not just, this is a symptom, we got to fix it this way. I mean, that comes, in the financial sector, in our government, in our school system, in our medical system. I think all systems at this point have this opportunity for us to shift them with each of our individual choices. So.
Absolutely. And here's what I know to be true in any area of our life. We get what we tolerate. So if you tolerate feeling less than fantastic, if you tolerate being treated with disrespect, or allow yourself to be in a situation where you feel like you're surrounded by people who are not uplifting you, we get what we tolerate. And setting those healthy boundaries, learning how to set those healthy boundaries, it can be uncomfortable for people. There are people who really struggle with that. But all I know is that when you start to make those shifts, when you start to make those changes and things start to move in positive directions, it unlocks a completely different future for yourself and those you love and those around you.
Absolutely. Yeah, it starts one step at a time. Well, I have two final questions for you, Dr. Neustadt. The first question is, what is your favorite product, wellness topic, or self-care indulgence at this time?
Such a great question and such a hard one to answer, to boil it down to one. So I can tell you my favorite products, because it is plural, and this is what I take every morning for my brain health, for my physical health, to help promote healthy blood pressure and circulation and cardiovascular health, to help promote healthy inflammation balance and support my bones and different areas of my health. My supplement routine, I take my NBI formulas, and my family does as well. So I'll take Brain Blend in the morning. I'll take my Best Catch Omegas fish oil every morning, which, by the way, is burpless formula and a beautiful lemon scent. And, again, the clinical doses used in clinical trials, up to the Best Catch Omegas is actually up to 50% more absorbable than other forms of omega-3s and other products. I take Natto Pine, which is my product for healthy circulation and support healthy blood clotting and healthy blood pressure. I take Joint Relief, which has different botanicals and botanical extracts to help promote healthy inflammation balance and for joint comfort and joint mobility. I'll take my OsteoK Minis product for bone health, and also to help with other aspects of health as well. And I'm trying to think, my vitamin D, so this is what I do. These are my favorite products. I'm fortunate. I'm in an amazing situation where I'm blessed to have been able to formulate and create products that people are using all over the world. And therefore, I can use my own stuff. I practice what I preach, essentially. And then one of my favorite health routines for myself right now is there are four of us in the household. We have two teenagers and my wife and I typically will get up at least an hour before everybody else in the house. That's my quiet time. That's my indulgent time to sit. I'll read for 30 minutes. I'll have my coffee. I'll leisurely get through my emails in the morning. That's my time for me. And so I love that nurturing self-reflective time is really important to take that time out every day. If you skip a day, it's not the end of the world. But that's what I say. That for me is one of my most cherished habits that I've developed.
I love that because you're setting the tone for your entire day. So many of us are getting up, maybe hitting the snooze button multiple times and then rushing through and skipping breakfast and all the things that contribute to more stress and anxiety. So I think that's really a wonderful morning routine. I love that quiet time as well. That's one of the things I do in the morning too. It's heaven.
Yeah.
So my last question for you is if you could detox one thing in your life or the world right now, what would that be?
Toxic people. It's that easy. It's very simple. I like taking complex ideas, and that's one of the things that really bothers me about my profession in medicine. They've got all these big words, and it's the same in any profession, whether it's finance or medicine. All these super complicated big words and concepts, and really a lot of these things can be boiled down, very simply and easily. When it comes to detoxing, for me, I think for me, detoxing toxic people, getting people. My wife and I actually sat down years ago. We had a conversation. We say, okay, we consciously decided that anyone who doesn't lift us up, who doesn't inspire us, who doesn't encourage us, we were no longer going to have them in our life. I think everybody knows those types of people, and they keep them around for some reason. They weren't serving us. We live to help serve and uplift everybody in our life. That's our goal. That's how we love to be. And so we decided, if people aren't like that, we're not going to tolerate that anymore. And our life got immeasurably better when we did that. So that's what I think it is for us. That was a good decision. And also just very simply, treat other people how you want to be treated. It's really not complicated.
Yeah, everything is a lot simpler than really we've made it as human beings. And I think that
Yes.
it really comes down to love. It really comes down to loving the self and loving others. And love looks in many different forms. It comes in as far as consideration or compassion or understanding, listening, patience. It shows up in many different ways, but it really is very simple. And it's really nice that you're leading into our upcoming episode on boundaries for healthy relationships, because that's
Oh,
one of the things we
fantastic.
actually talk about, that if you have toxic people in your life and they aren't supporting you, because you are the summation of the people you surround yourself with. So why not? There's nothing wrong with that, especially if you're doing it in a loving way, to set that firm yet gentle boundary of say, hey, we just can't have you. And, this is just not supportive for us. So I love it. Yeah. Thank you so much for coming on. Is there anything else that you'd like to share?
Yeah, I would just like to say for your listeners, I would love to offer a discount if they're interested in any of my work or products. They can use the discount code NBI. That's Nutritional Biochemistry Incorporated, NBI 30, NBI 30, as a coupon code to get 30% off any of the products on my website at nbihealth.com. And actually with quantity discounts, the percentage, if they take advantage of that, could go even higher, because I really want to help people take advantage of solutions that could help them feel better and provide this opportunity and products that actually give demonstrable changes that they can experience.
Absolutely. Yeah, and it takes one step at a time, doing one technique, one supplement, one whatever it is that you're needing. It doesn't have to be, like we said before, it doesn't have to be complex.
Exactly.
Yeah. Thank you so very much. We're so grateful that you're on. I'm really looking forward to having you back. We absolutely would like to have you back
I'd love
for
that.
more. There's so much more I'd like to talk to you about. So, well, again, thank you guys so much for listening. If you have questions, if you have anything you would like to ask that we could maybe potentially ask Dr. Neustadt in an upcoming episode, please send us those questions, and I will put all the information in the show notes so you can easily go to his website, check out some of those articles, and of course, take advantage of that coupon code because that's fabulous. But again, thank you guys so much, and be well until next time, my friends.
Thank you for listening to the Mind Body Detox podcast. We wish you wellness and health in your mind, body, and spirit. And be well until next time, my friends.